Good afternoon from China. My name's Will and I live in Changsha in Hunan, which is 300 kilometers south of Wuhan, and I think you'll remember where that is. I think this report is timely because you've probably heard that there's been an outbreak of the Delta variant in Nanjing. But what's particularly alarming is that this outbreak occurred in the airport. Can you imagine of a worse place to have an outbreak of this highly transmissible variant? As a result, it's now spread to something like 14 different provinces. The numbers are still quite low, but it's had about 20 days, more than 3 weeks to actually circulate. Through their investigations, they discovered that it resulted from airport workers cleaning a plane from Moscow which had been infected. While the airport staff are all required to be doubly vaccinated, it seems that the cleaning staff didn't follow all the guidance about use of PPE and health protocols. And cleaning out rubbish, etc., they got infected. This was only discovered through regular testing carried out on the 20th of July, that 10 days later. So those staff had 10 days when they were possibly infecting others. Not only that, the airport stayed open until the 27th of July, Tuesday this week. So there were more possibilities of this Delta variant spreading out. They have been very careful in Nanjing. They've tested the whole population, that's over 9 million people, not once but twice in the last 10 days. But still it has spread. One person flew from Nanjing to the north west corner of Hunan, where there's a beautiful scenic area called Changsha, and you might know it because it was the location where they filmed the movie Avatar. Well, they have lots of shows there, and it was discovered that a particular show on the 22nd of July turned out to be a super spreader event. They had a packed house of over 2,000 people. While there was a mask wearing mandate in place, it appears it was not policed closely, and people got infected. It is not surprising. Hunan has not had a case of community spread since about the end of April last year. That's a long time. Now, I am fairly cautious, but even I've stopped wearing my mask the last month or two. But things have now changed and everybody is wearing their masks. One person from Changsha travelled back through Changsha and caught the high-speed train back to Beijing and has since brought about the first community spread infection in Beijing for over 6 months. Because they had time on their hands, they stopped in Changsha, went to a restaurant in a mall nearby, and everyone in that mall has been tested, or one person has been found to be infected. My wife's daughter works there, has a shop there. She was tested. Thankfully, she was found to be negative. It just goes to show you can't be too careful, even if you've not had any infection in your country for months or maybe even a year. The story of Taiwan, Vietnam, Thailand, Australia is the same. We have to keep our guard up. Keeping our guards up, I have now had my 2 vaccinations with a Sinovac. I've had no side effects. I thought perhaps I might have had a side effect after the first jab. 4 days afterwards, I developed a cold. Now, I was very alarmed by this because I know cold symptoms go along with the Delta infection. But since at that time we'd never had any community spread for over a year, I put my fears at one side. The cold symptom thankfully disappeared after about 4 or 5 days. I have been taking vitamin D, having heard about its usefulness from Dr. John. I take 4,000 IU a day, and I'm happy to say that it may be that this helped me get rid of the cold symptoms. Normally I have 3 colds every year, and after the cold symptoms disappear, I normally end up with a persistent cough for a couple of months. Thankfully, the cough all went after 4 or 5 days, so I'm very grateful. When I had my second jab just earlier this week on 27th, there was still a lot of demand, even though the alarm had not been raised in our area. I had a 2-hour wait, and we arrived at 2:30, and by 3 o'clock the staff had to turn new arrivals away because they'd never be able to be vaccinated before closing time. Now, of course, the queues have got a lot longer and everybody is wearing their masks again. So we're being careful again. I hope that you're being careful and your communities are being careful. There is one paradigm that works in this pandemic: an abundance of caution. Please be careful out there. Bye-bye for now.